So lower back pain is a very common problem for a lot of people. This is not just in the United States. This is also globally within the entire world. It's a very common reason for people to have pain, and more importantly to go see a doctor to identify why they have pain. I have a spine model here, and I want to give you a basic overview of why pain can happen. First of all, while this almost looks somewhat rudimentary, this area is very complex. Think of it as a three-dimensional structure, many different muscles attaching to this area, bones, joints, disc spaces, the tailbone, the sacroiliac joint, the hip attaching to this area, and then the pelvic ring. So very complex area. A lot of reasons why you can have pain in this area. And teasing out the right area of pain is probably very important for you to have a successful outcome. Common causes of back pain can be discogenic. So you can have a bulging disc or a herniated disc or a degenerative disc that can cause pain, and typically that disc can herniate either straight backwards over here, could be a little bit on the side over here. What that does is it causes pressure either on the spinal canal or in the foramen. The foramen is this hole where these orange nerve roots are coming out of. And when this nerve gets pinched, it can cause a really painful sensation that's going down your leg, maybe into your buttock, into your hip, or into your foot. It can also be associated with numbness or tingling and sometimes even weakness. And there are potential options for treatment for that. You could also get back pain from these joints in your back. These are joints that allow some movement and create some mobility, but they can get arthritic, they can get irritated or inflamed, and they can cause pain. Some people also have little fractures that develop in this area, and that may be associated with some instability and some pain symptoms. There's multiple muscles and tendons that attach to this area, and that can also be associated with pain. And then there's another cause of pain, right? There could be referred pain, pain that is presenting in the back, but is really not associated with anything to do with your spinal structure. It can be coming from other areas. For instance, if you have a bad hip, it may be presenting as back pain. You could have abdominal causes of back pain. Certain types of cancers might present with presenting symptoms of back pain. And these are things that your physician needs to really evaluate you for. This is what we do at Carolina's Pain Center. We are trained in this area, and we are highly trained to go seek out what is the cause of your back pain, why are you having it? And once we've identified it, then we can decide how to treat it. Imaging tests like MRIs, X-rays are useful. A good physical exam is also very useful, and having an expert or a trained specialist to help put those two together along with your symptoms to identify what is right for you is what gives you a good outcome. Come see us at Carolina's Pain Center.